Hey folks, Dr. Walker from dinnerwalker.com. Welcome back to the channel. Today I'll talk a little about diabetes, specifically type 2 diabetes, and some concerns. So typically what happens is you go in and get your blood drawn, and a few times you go in and your blood sugars are elevated, and so your doctor may say to you, hey, let's check this again in a couple of months, and they'll do an A1C, hemoglobin A1C for you. And that is elevated as well, somewhere 7, 8, 9, 10, 13, any of those numbers, and they'll say that you have diabetes. And at first, they'll typically will give you some pills, typically metformin, and I'll say take this pill, and it goes from once a day to twice a day, or sometimes even 3 times a day. And then they'll go beyond that. They'll add another medication on your list of profiles of medication to take, because they're still saying that your blood sugars are not getting any better. They're about the same, and they're elevated and they're high. And then it'll go on to where they begin to offer you injectable insulin, and the dose will start out pretty low at first, and then it'll go higher and higher and higher until the insulin is no longer working. And then finally they'll say, it's time to set you up for hemodialysis. And that's typically 3 times a week, and really it's most of your day. So typically people who are on dialysis are not people that's going to be working a full-time job, because it's Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, and you're typically gone the entire day. And starting with metformin, you feel like crap. And I think what happens to a lot of folks is they're feeling unwell to begin with, and then they start taking this metformin, and they feel crappy still, but they continue taking it because their doctor's telling them to take it. But now, nowhere in this whole discussion do I typically hear the provider saying to their patients, hey, by the way, watch your diet, remove these things from your diet, and get your blood sugars normalized, insulin levels normalized, and then we can see about that, right? And because a little while ago, the idea was that once you become a diabetic, there was no going back. That was it. And so a lot of folks took it that way. In other words, regardless of what you did in terms of diet, then you were still a diabetic, and because you're diabetic, just continue taking this, metformin and the shots and the pills and dialysis, and that's really it, right? And that's the end of it. Once you fail dialysis, once dialysis is no longer working for you, or you have a complication from dialysis, then that was it. You were done. And that's really what I want to talk about. And I've heard people say that docs say, they're not going to listen anyway, patient will not listen anyway, so what's the point, what's the use? And so that's not my take on stuff, and that's why a lot of providers and myself, we don't get along, because to me, a strong push on what you put in your mouth, what you eat, specifically, those things should first be discussed before we start pushing pills on folks, because again, it doesn't get better. It doesn't reverse the process. It doesn't, right? The metformin will not reverse your diabetes. You are a diabetic, bottom line. But what you eat, what you consume, how you eat are always that should be discussed, and again, not discussed as to how to reverse or reduce your risk going forward from going from, let's say, a pre-diabetic to a diabetic, right? So those things are my concern, and very few times we talk about those things. So typically, again, diabetes, chronically elevated insulin levels, chronically elevated blood sugar levels, and again, it's really much of what you eat. So let's talk about that. So some things that folks eat that cause your blood sugars to go through the roof. Foods that are high carb foods, processed foods, even things like oats. And invariably, when I tell a person that oats spike your blood sugar levels, they look at me as though I have horns, right? It's just what happens, because we have been conditioned to think that what is on the commercials on TV regarding food, specifically oats, that those things are good and healthy and healthy for you. No, right? No. Just no. And a lot of folks will look at me as though I'm crazy. And again, it's just how it works, right? Oats are not good. A bowl of cereal is not good. Pop-Tarts, Twinkies, cupcakes, seed oils, all of those things, none of them are good for you, because all they will do for you long-term is cause elevated blood sugar levels, cause diffuse inflammation, and essentially get you on the train for becoming a diabetic, and that's really it, right? So if it's processed foods, if it's in the stores, on the shelf, in a box, in a paper bag, somewhere on some person's shelf, if you're a diabetic or you have been told that you're pre-diabetic, all of those things need to be off of your list. All seed oils need to be off of your list. Cereals in general, oats in general, flour, spaghetti, all of those things, they must be off your list. And again, you can hear me if you want, and you can listen to it. But if you choose not to listen, that's my job is done, because I try to tell folks what they should and should not do regarding some things to eat. Those things are bad for you. The things I just mentioned to you, they're bad for you. Processed foods, bad for you. Cookies, cupcakes, Twinkies, pies, they're bad for you. They all cause inflammation, they all cause elevated glucose levels, and they all cause insulin to increase. That's a problem, right? And many times our providers don't have this discussion with folks to say, hey, consider these things to be removed from your list and go for it. Natural unprocessed foods is what you really need, right? More green leafy stuff. Reduce the carb, reduce the starches as best as you can. More natural foods. Those are the things you have to do. The other thing that helps a lot regarding decreasing your insulin resistance or insulin levels in general, and decrease your blood sugar levels chronically, and decrease your hemoglobin A1C chronically, is intermittent fasting, right? And I tell folks all the time, try if you can. The other big lie that they tell is that breakfast, quote, is the most important food of the day. You typically have enough, for the most part, glucose in the morning when you wake up to get you to the next level, right? And intermittent fasting, it's not one of those things you do. You don't go 20 hours the first day, or the first 2 days, or the first 3 days without eating, right? Start gradually. Maybe do a day first. Go do a 8-16 fasting. So in other words, if you skip breakfast and have a dinner or like lunch, protein based lunch, and then or high fat lunch, and then have a regular dinner, again without the processed carbs, flour, Twinkies, cupcakes, spaghetti, without those things. So a normal lunch essentially, and a normal dinner essentially, high fat if you can, and either one of those two, the better you are. The more processed foods you get, the worse you are. So if you can do that 1 day a week at first, and then maybe 2 days, maybe 3 days, and obviously let your doctor know, because typically you're going to be on some medication if you're a diabetic, and that is a condition essentially of having essentially high glucose levels. If you're on metformin, for example, and you're not in your intermittent fasting, you may run the risk of having too low blood sugars, and so that could be a problem for you. So let your doctor know about what you're going to do, and be certain that they are in accord with what you're thinking about or trying to do, especially intermittent fasting. You do not want to do that and get your blood sugars levels too low, and then that becomes a problem for you short-term or long-term. But that works, right? So if you do those two things, if you do intermittent fasting, have a light lunch, again, skip breakfast, have a light lunch, or if you choose have breakfast and lunch and then skip dinner, any of those things is going to work for you. The other part you can probably do is just even light things, like after you've had your meal, go for a short 5 or 10 minute walk, help to sort of reduce that requirement for that sugar to be stored as fat. Those things all should all work for you. So intermittent fasting, yes. Reduce your processed food consumption, yes. Reduce your seed oil intake. And just light exercise. And the more you can do, obviously, the better you can, but don't hurt yourself, obviously, right? Small strides is what we're talking about. So if you can walk even a quarter mile, then a half mile, then a mile, then 2 miles, all of those things are really good for you to reduce your blood sugar levels, because the picture I painted for you to begin with, in that you're going to go from having essentially elevated A1C, high sugar levels, high blood glucose levels, high insulin levels, metformin, injectable insulin. Then the next thing is going to be having dialysis. And once you're done with dialysis, then you have no other option. There's nothing else for you to do. There's nothing else for them to give you once dialysis has failed you, right? Anyway, thanks for listening, Dr. Walker.